Today we are going to know more about Centerline. It is exam oriented, very much important topic. I can ensure that it will be more beneficial for your upcoming exams. So you have an idea about what is Centerline. So Centerline is a thin flexible tube inserted into the large vein to give medications or fluids or blood products or obtain blood samples directly from the center circulation. So then we are going to discuss about its types. Then what are the types? That is, the common types are, first one is tunneled, non-tunneled, non-tunneled, tunneled, and peripherally inserted central catheters or implanted catheter or dialysis catheter. These are the types. So here is the picture for your reference. These are the types of central lines. First one is tunneled catheter. So what is tunneled catheter? I will zoom it for you. I can't do it. Okay. Let's look at this. Okay. What is tunneled catheter? Tunneled catheter, this catheter is not directly enter into the large vein. It goes under the skin, then it's enter into the large vein. That is tunneled. That is tunneled catheter. So it's not directly enter into the vein means there is chance of infection is very low and its durability is very high, that it can be used for weeks to months. So this is tunneled catheter, and these tunneled catheter insertion needs surgical or radiological interventions. That's all about tunneled catheter. Then what is non-tunneled catheter? Non-tunneled catheter is, this catheter is entered directly into the large vein. That is non-tunneled catheter. There is no tunneling. It is directly entering into the vein. So there is chance of infection is very high. And this is not need very much time. It's very quick to insert. That is non-tunneled catheter. In our usual ICU settings, we are saying this non-tunneled catheters. So the durability is very low. It can be used only for 2 weeks, and the chance of infection is very high. I already said that. So that is the difference between our non-tunneled catheters and tunneled catheters. Then what is PICC line? PICC line, the full form is peripherally inserted central catheters. So peripherally inserted means the arm vein is used for the insertion. That is cephalic vein, basilic vein. Through this vein, the catheter is inserted into the superior vena cava. That is the PICC lines. So what are the veins we are used for inserting catheters? We can use femoral vein, subclavian vein, and internal jugular vein. That's all about tunneled catheter, PICC lines, and non-tunneled catheters. This is dialysis catheter. So, how dialysis catheter is different from other usual tunneled and non-tunneled catheters? Look at this size. The size or the fringe or the bore of the lumen is very high when compared to the usual tunneled or non-tunneled catheters. So there are two lumens. One is red in color, one is blue in color. The red color lumen is already called, the red color lumen is called arterial lumen, and blue color lumen is called venous lumen. And the red color lumen is used for drawing blood from the body to the dialysis machine. And the blue color lumen is used for returning the blood from the dialysis machine to the body. We already said that the common sites or veins used for inserting the catheter are femoral vein, internal jugular vein, and subclavian vein. But in dialysis catheter, this subclavian vein is not used because it can cause stenosis. That's the difference between dialysis catheter and usual catheters. Then what is this? This is implanted catheter. So implanted catheter, the anterior chest is connected to the large vein using a catheter. So there is chance of infection is very low in this type of catheter, and we can access this catheter by pricking a large bore needle or a specialized needle. We can access the vein. That is implanted catheter. The chance of infection is very low and the durability is very high. It is commonly used for chemodialysis purpose. Okay, that is the different type of central lines. Then what are the common site of insertion? And there are three sites, that is internal jugular vein, subclavian vein, and femoral vein. So in subclavian vein, there is chance of pneumothorax is very high, and in femoral vein, there is chance of infection is very high because there is near to the private part, and there is chance of infection is very high in femoral vein access. Then next one is, what are the normal CVP? Normal CVP is 3 to 8 Hg, and in centimeter of water it is 5 to 10 centimeter of water. The important point to remember when inserting a center line is, first one is the position during center line insertion is, we have to give a Stendenberg position, that is 10 to 15 degree low position. That is the best position for center line insertion, and the technique of insertion is cylinder technique. What is cylinder technique means? Cylinder technique is using a guide wire for insertion, that will decreases the chance of trauma. Then when to measure CVP? So center lines is used for measuring CVP. So when to measure CVP is during expiration, we have to measure CVP. Then what is the CVP manometer placement? That is at phlebostatic axis. I will see a picture for that. What is phlebostatic axis? Phlebostatic axis is the line intersecting the two lines. The two lines means fourth intercostal space, a line from the fourth intercostal space and mid-clavicular line intersecting at a point, that is phlebostatic axis. So we have to place the transducer in the phlebostatic axis for measuring the CVP. Okay. Then center line care, which is very important. In center line care, there is a transparent dressing over the center line. We have to change it at least within 7 days, or when it is soaked, or when it is blood tinged, we have to change it at that time, or there is no such event, then we have to change it as within 7 days. Then dressing change third day or when it is soiled. And uh, in some protocol, some we can change it daily, or mostly we can change it at the third day or when it is soiled. Then what is port care? Port care, there is rubbing and resting. That is, we have to rubbing it for 15 seconds and resting it for 15 seconds. So port care, the cleaning, we have to clean it with 70% alcohol, and in skin preparation, we have to prepare the skin with 2% alcohol. Then flushing. So after every medication administration, we have to flush it with 10 ml of NS.